Today, nose fillers. There's no business like Snow's business. Everyone knows that you can use dermal fillers in the schnoz. That's the nose for anyone unfamiliar with this medical terminology. But how can we combine it with other treatments in the face for the best results? Let's go over to the iPad and check out our patient. So what jumps out at me from this lady here? Well, a couple of things really. The first is she's got quite a flat central forehead. So you may remember me telling you in previous videos that it looks much better if you have a bit of a curve in the forehead. It's a much more youthful look. The second thing that we can really see is these nasolabial folds here. And that's not often something that I pick out, but that's definitely something that I'm picking up right now. She's got lovely full cheeks, doesn't she? We've also got a bit of a horizontal crease across the chin, and the lower facial third is just a wee bit short for me. Looking at the nose in particular, you can tell even from the front that the bridge may be just a little bit flat. Let's have a look at exactly how it was done. First thing, we do some Botox. So we're doing the frown lines, the forehead and the crow's feet. We're also going to put some in the lower part of the face. Next, we're going to draw where the highest point of the cheek should be. So this is something that I do quite commonly. And this area here should be the area of maximum light reflection. We're then going to go ahead and use some dermal filler here. We're using something that's pretty robust to give the lift. And then we're going to go ahead and place some dermal filler in the front part of the cheek, because although she's got really lovely full cheeks, they could just do with a little bit of tweaking so that the point of beautification is at the correct point. That's the area of the maximum fullness of the cheek. Now we're going to go ahead and use something kind of medium weight at the base of the nose. So the reason why we're doing this is to help to improve the nose to mouth line without directly injecting the nose to mouth line. You can also see that the nose is maybe just a touch wide. We're going to go and use the same product in the central portion of the chin to give the chin a bit more of a point and a little bit more projection. Now I'm switching to a cannula and I'm just doing the jawline to straighten that off here. And now I'm going to turn that around and use the same entry point going up the marionette line to give a bit more lip support. This is an area that we often lose volume in as we get older, and people do look at me a little bit funny when I say, oh, we need to add some more volume in this area of your chin because that's looking a bit deficient. But it's actually really important to do that, because without augmenting the chin and getting good volume there, the lip is never going to look right. I'm going to go and swap now and use an insulin needle instead of a regular needle to get that curve back in the forehead. So we first identify where the volume loss is in the forehead. And I'm using an insulin needle because the tip of the needle is slightly different to the tip of a regular dermal filler needle. It's a little bit flatter, which means that you're much less likely to run into problems with the anatomy there. Now, let's move on to the main section, which is the nose. So you can see that I'm going to use an insulin needle now to do the radix section of the nose, which is that bit just there. I also want to try and turn the tip up slightly. We're going to inject directly into the tip and then underneath the nose to push it upwards. So when you inject right here, it will tend to rotate the nasal tip up slightly. We've also placed some Botox here to stop the nose from being pulled down on smiling. So it's a little bit of everything that we've put together to get this nasal improvement. On a woman, the nose should start to take off in line with the upper lash line. So if you draw a line from where you see your eyelashes across to the nose, that's where your nose should begin. And we could see that on her, the nose was just beginning a little bit lower than that, which meant that we had plenty of scope to be able to try and straighten it and rotate it upwards. Lastly, I'm going to finish with the most controversial treatment of all, the nasolabial fold. So I often don't inject this area. It's normally the area that most people learn how to inject first thing. So, when we're first learning these procedures, we do nasolabial fold and lips second. I don't know why, because anatomically speaking, the nasolabial fold is one of the most dangerous areas to inject. Let's go over to the iPad to have a look at the before and afters. So we can see that we have got a much more rounded forehead here. We've got rid of that flatness in the center. You can also see that we've got a bit more of a kicker up of the brow. The tail of the brow is just that little bit higher than the head of the brow now. If we look at the before, you can see that the tail is not quite as kicked up as it is in the after pictures. We've also got an improvement in the crow's feet area, and moving down, you can see that the curve of the cheek is now much nicer. It's really lovely and soft there on both sides. We've got an improvement in the hollowness in the chin. You can see that here and here. And that's had the side effect of making the lower lip look a little bit more full. We've got an improvement in the nose to mouth line also. And you can see that the nose looks like the light has just changed slightly. So you see there's light reflection here and here. And then on the before, the light reflection is here and here. But it's just a little bit longer in the after picture, which makes the nose look a touch slimmer. I just want to show you how her nose looks now from the side. So can you see that we've built this area up here, and in the before, the nasal tip is rotating downwards. Here, she's got a little bit of a ski slope going on there now. You can also see that this angle here has changed. So it's a little bit less acute now than it was before, because the whole nose is rotated upwards. And you can see a little bit more of the columella, which is this bit of the nose right here. Okay, so that's it for today. Hope you enjoyed the video. If you've ever had nose filler or you're thinking about having it done, don't forget to let me know in the comments section below, and join me again next week for some more patient shots. Don't forget to like, comment and subscribe.